Assalamu alaikum. This is Masura Mir having roll number BP1650132, and I'm going to present my pharmacy practice assignment, namely essential drug knowledge for a pharmacist. We're going to move on with the introduction of the drug. I am assigned with a drug named Dimercaprol. It is a medication used in the treatment of toxic exposure to certain metals like arsenic, mercury, gold, lead, and hence it is used as an antidote to the chemical weapon lewisite, and it belongs to the class of chelating drugs. As we've already mentioned that it belongs to chelating class of drugs, the mechanism of action is obviously creating a chelate complex with the enzyme so that the enzyme cannot bind with the metal ion. Dimercaprol actually completes with a thiol group as double bond O group of the binding of the metal ion, and it is then excreted out of the body through urine. Main indication of dimercaprol is obviously in the treatment of arsenic, gold, and mercury poisoning, and it is also indicated in acute lead poisoning when it is used with ethylene diamine tetraacetic acid, that is EDTA. The most common side effects of dimercaprol that we see in patients are fever, tightness in chest, limbs, jaw, abdomen, hypertension. So it can also result in high blood pressure in certain patients, fast heart rate, and injection site pain or the formation of sepsis. This actually happens because we administer dimercaprol through a very painful intramuscular injection that can lead to this injection site pain and the formation of sepsis. Other side effects include GI disturbances like nausea, vomiting, headache, numbness and tingling in hand, tremors in hand, eyelid twitching, conjunctivitis, tearing, nasal discharge, and kidney toxicity. Nephrotoxicity is actually a very common side effect of dimercaprol. We're going to move forward with further information on the drug. So, when we talk about the drug interactions of dimercaprol, it has no listed interactions with other drugs. So, we actually request the patients to whoever they're consulting, the doctor or pharmacist, to tell them all the medications that they're taking at the time. So, everything can be monitored accordingly. Now, the drug toxicity is related to dimercaprol is basically it is a toxic drug itself. It has a very narrow therapeutic index, a very narrow therapeutic range, and it also has a tendency to concentrate arsenic in some organs and gold in some organs, mercury, basically the concentration of metals in certain organs. Other disadvantage, as I've already mentioned, that we need to administer it by a very painful intramuscular injection and which cause the injection site pain, the formation of sepsis, and it can also cause very severe nephrotoxicity and hypertension. Alternatives of dimercaprol available in the market right now is one of the most used one, the water soluble derivative and a very modern chelating agent. The modern chelating agent is dimercaptosuccinic acid, abbreviated as DMSA, and it has largely replaced dimercaprol because it has a broader therapeutic index, broader therapeutic range, and very fewer adverse effects than dimercaprol. Another water-soluble derivative of a drug is 2,3-dimercapto 1-propane sulfonic acid, which is abbreviated as DMPS, and it is also used instead at some points. Now, the irrational use of dimercaprol, as we've already mentioned, that it is a toxic drug itself and having very narrow therapeutic index. The irrational use actually includes the inadequate dose given to the patients. So if a patient is suffering from gold poisoning or mercury poisoning, the dose has to be adjusted according to the patient and basically the toxicity. And if a patient is suffering from arsenic poisoning, the dose has to be adjusted according to that metal poisoning. So, in accordance with different metal poisoning, the dose of the drug needs to be adjusted. So, one of the rational use of dimercaprol includes inadequate dosing that is given to the patients. Now, we have a case study related to uh, a metal poisoning and how we're treating that. So, a 30-year-old white male presents to an emergency department after ingesting white powder from a bag that was given to him by his friend. He has developed weakness, vomiting, and diarrhea. These are some of the reports that we have received. There was no past medical history. Physical examination actually indicates temperature, heart rate, respiratory rate, and BP. Temperature is 100.4 degree Fahrenheit. Heart rate is 120 beats per minute. Respiratory rate is 20 breaths per minute, and BP is 90 by 60 mmHg. Generally, when he is actually evaluated, his conditions evaluated, general evaluation was that he was awake and alert, but he was obviously actively vomiting and having diarrhea. When we listened to his pulmonary and obviously cardiac rate and everything through a stethoscope, it was clear. CB actually indicated tachycardia without murmur and with normal perfusion. The questions related to this case study are basically number one, from what type of poisoning is this patient suffering and what are the typical signs and symptoms? And number two, obviously, what is our plan? What will be the initial therapy? What should be instituted? I'm going to question all these, both of these questions in my soap notes. So the subjective, basically, the chief complaint that the patient has is that he's having vomiting, diarrhea, and is obviously feeling very weak. The objective has all the history and all the lab reports that we have received. So it's all mentioned here. He's 30-year-old white male. There was no past medical history. The physical examination is as follows, and all the other evaluation that we received. Now, the assessment, obviously, we've evaluated that the patient is suffering from arsenic poisoning. The white powder that was obviously found with him was rapidly identified as arsenic, and we used actually urine arsenic. We used actually urine sample for the analysis and blood sample, and obviously it was indicated that the person was suffering from arsenic poisoning. Now, initially, the management should be focused on stabilizing the airway, the breathing rate, and circulation. For that, this is the initial therapy basically. The patient should receive two large Bora IVs and should be placed on a cardiac monitor with continuous pulse oximetry. So we have to actually monitor everything. Okay, the cardiac output, also his oxygen levels, all the breathing and circulation and everything. Then we can start with the chelation therapy, and it should be initiated as soon as possible. And as soon as we have realized that there was some metal poisoning, it is started with unithiol, which is DMPS, and dimercaprol, BL, and basically unithiol is second choice if BL is not available, or we can also give the succinate, DMSA, under the direction of a medical toxicologist because we have to monitor the toxicities. These are the different references that I use for the affirmation and to present my presentation. That is all. Thank you.